Are you interested in learning about affordable and accessible ketamine assisted psychotherapy? Well, if that's the case, this video is for you because I have with me Dr. Tiffany Sauls, director and founder of Asheville Integrative Psychiatry. And that's what we're going to talk about. This is Eddie with A Mindful Emergence, where Margaret and I offer mindfulness, movement, and breathing practices to support your healing and spiritual transformation. And most of our work now is with plant medicine. And I'm so excited to have Dr. Tiffany Sauls with me today because she's doing really wonderful work. Tiffany is the director and founder of Asheville Integrative Psychiatry. As I said, she's a board certified child, adolescent, and adult psychiatrist who specializes in integrative treatment for mental health. Her path to psychedelic medicine came from an early curiosity about the healing potential of plants and nature. Dr. Sauls has completed training through the Multidisciplinary Association for Psychedelic Studies, MAPS, which is where I got this hat for just $20. She is also trained in internal family systems, IFS, which we love. And Dr. Sauls is excited to bring psychedelic medicine combined with nature immersion, both to the Southeastern United States and to the forefront of psychiatry. And thank you so much for joining me, Tiffany. Welcome.
Thank you, Eddie. It's good to be here.
Yeah. So when did you create Asheville Integrative Psychiatry and why?
Yeah, well, so I've been practicing psychiatry for 20 years, and most of that was with adolescents in residential treatment settings. Most of the adolescents I worked with suffered from PTSD, and there's just not a lot of options out there for healing trauma. It's all symptom management.
Mhm.
And I read the research, I guess it's been about 6 years ago now, from the Mithofers about MDMA assisted psychotherapy for PTSD, and got super interested in psychedelics, and already was doing integrative mental health, which is just holistic look at what's going on, with diagnoses and how do we use supplements and lifestyle and stress management and, other approaches like neurofeedback or mindfulness, how do we incorporate all that into treatment? And I was like, hey, we can add psychedelics to that. And I forgot to mention, I'd also done a few years with the Children and Nature Network and a prescribing nature program for children and adolescents to support mental and physical health. So, all of that kind of rolled into one is how I created AIP, and that was about 4 years ago now. And we've been out in Candler, which is about 30 minutes outside of downtown Asheville. We're on 16 acres. It's just gorgeous out here. We use the land, we connect to the land. We built treatment spaces up on the hillside that are integrated into the landscape, and they look out onto Mount Pisgah, and it's a beautiful place to work and to work with patients.
How is that helpful? Why is it helpful?
Are you asking about the nature component or the integrative?
The nature specifically.
Yeah. Well, there is lots and lots of research out there on why and how nature can be healing both for physical and mental illness. And if you want to see a compendium of the research, the Children and Nature Network has, hundreds of articles there. But, pick any diagnosis, and I could probably find you a paper that shows, like, specifically for ADHD, like what happens in ADHD, and, with some kids, a lot of times ADHD has a root cause in like trauma or anxiety or depression, but more, typical ADHD, um, directed attention can get really exhausted in like a classroom setting. And if you're able to go outside in a natural setting and relax and use this like undirected attention, kind of this like awe and wonder and
Mhm.
just like absorbing like multisensory kind of thing where you're just kind of soaking it up, you can you can restore the ability to get back and use your directed attention again in the classroom. So that's
I think about my meditation retreats that I always do in nature settings. It's important. Yeah.
yeah.
Yeah. So how do you determine suitability for ketamine? You must have people contacting you, a lot of people wanting help. Some of them are desperate. How do you determine if ketamine and and by the way, if we haven't made this point because we feel it's kind of obvious, but it might not be obvious to everybody. Ketamine's legal, and MDMA isn't yet, hasn't been approved. But you're using ketamine. How do you determine if a person is right, if ketamine is right for them?
Yeah. So we we have a pretty comprehensive screening process here at AIP. And we start with an online self-screening tool that basically says, do you have these diagnoses A, B, C, D? And if so, ketamine's probably not appropriate. And some of those rule outs are primary psychotic disorder, if you're pregnant, if you are actively in addiction or mania, if you have significant like sleep apnea or even central sleep apnea, hypertension that's uncontrolled. There's a list. And then if you pass that checklist, then we say, okay, give us a call, and then let's further screen for this. And then there's just, step by step, we will collect records and meet with a person for an hour, talk about their mental health and physical health history, and determine if ketamine's an appropriate part of their overall treatment plan.
Mm-hmm. And I know ketamine is particularly helpful for treatment resistant depression. At least that's my understanding.
Mhm.
But is it also helpful for addiction if somebody comes to you with substance use disorder or struggling to stop drinking? I'm not talking about the people who are under the bridge. They need to go to detox. But do you have people coming to you like that?
Yeah, yeah. So ketamine is Spravato is FDA approved for treatment-resistant depression. Um, ketamine, racemic ketamine mixtures can be used off-label for a variety of things. And so depression definitely, PTSD, OCD, eating disorders, addiction. And I think of it as if you suffer from something that's like a ruminative disorder, like you're stuck in certain ruts or patterns, and it's hard to like move out of those. And that can happen kind of across the board in a lot of areas. Addiction is one of those, but OCD and depression and anxiety, eating disorders, they're all. So if that's what's impacting you, then yes, ketamine can be really helpful for giving you a reset. And you may have heard default mode network and kind of taking your ego offline and just opening up a neuroplastic window for new patterns of habits and behaviors to form.
Now,
So
does
yeah,
ketamine quiet the limbic system, the amygdala, from acting out? I mean, just my understanding is that because it's a dissociative, essentially, you don't have the body load with some other medicines. And so because trauma is stored in the body, talk a little bit about that, if you can understand where I'm headed with this.
Yeah, yeah. So specific to trauma with ketamine, and that's one of those things where some folks are like, well, I don't understand, trauma causes dissociation. How is a dissociative helpful? And that's a really good question.
Yeah.
But what I would say is ketamine it's useful in pain management. So you can, physically have dissociation from the symptom of pain, but you also in that process have like are able to gain some perspective on maybe the event that was
Hmm.
causing that psychological pain, which often then leads to physical pain and ailments and um, yeah, long-term physical health issues. So that level of dissociation or separation from the psychological pain can give you an opening to reprocess
Right.
and
Without
yeah,
being back in that experience.
yes.
Yes, yes, yeah. So you're in an outpatient setting, you're not at Mission Hospital or Party or any of these places. You're out in Candler in your facility out there.
Mhm.
So let's talk about the risks and the benefits of an outpatient setting. Now, we've talked a little bit about the benefits in that you're out in nature in this, beautiful setting. What other benefits are there in an outpatient setting? And then we'll talk about the risks.
Yeah, well, I would say, benefits of being out here at AIP in Candler is you are removed from like the hustle and bustle of the city. You get here and you can just slow down, and we encourage people to, we have these nature meditation cards on the front desk. When you get here early, pull a card, go sit down and just drop into this setting.
Hmm.
It's really peaceful, it's really quiet, it's really beautiful. Um, the other thing is this, though we have all the medical equipment and AEDs and oxygen and all the stuff, it doesn't feel like a medical office, like a doctor's office. It feels like you're out at a retreat. Um, and so, just in terms of like comfort and relaxation, I think a lot of people are really drawn to this setting
Hmm.
over a clinic or
Yeah.
in town where it might be a little noisier or yeah.
Now, I did have one experience with ketamine, and it was not recreational. I actually worked in a clinic and had an opportunity to have it administered to me so that I could understand the terrain that people were navigating since I was in support, preparing people, integrating people, sitting for people. And it was administered IM, intermuscular, by a nurse. So I know you're a psychiatrist. Are you the one administering it? Do you have a nurse or another provider? You must have a team of some kind through this process. Talk about that, please.
Yeah, yeah. So out here we do sublingual and intramuscular. There's no IVs. We're not doing intranasal. Sublingual is self-administered. And so we do advise on dosing, and we will help people get the appropriate dose, but then, that is self-administered.
And are they doing it there, or is this a take home?
Yes, yeah, we do sublingual here. We also do through another program called Watershed Healing Collective. We will prescribe for patients to administer sublingual in their therapist's office. And there's a whole nother level of screening that goes on for that and training for the therapists, but that's another thing that we offer. Um, and then for intramuscular, yeah, that's either me or we have a nurse practitioner also that works here and provides the administration of the medicine and medical monitoring. So we're also getting vital signs before, sometimes after, and checking in the middle if we need to, or staying close by if it's someone who's more medically fragile. So.
And of course, with all these medicines that create an enhanced state, psychedelics, empathogens, integration is key. Talk about that. How you do that.
Yeah, well, I appreciate you bringing that up because I think that's really, really important.
And sorry to interrupt you, but separates guys like you and a couple other people I know in town from a lot of the places that are called pump and dump.
Yeah,
Just being
yeah.
candid.
Yeah, so we are doing ketamine assisted psychotherapy out here. So there's no get your medicine and go and
Have a nice life.
yeah. Um, and so along with integration, there's the preparation, preparing for the medicine and preparing yourself mentally and physically to be with the medicine. And the session itself is important, but it's what you do with the information that comes up or the insights you have. And that integration, that's where the therapist who is sitting with you during the session takes notes, even to the point of like noticing physical sensations, like if you're shaking at a certain time or you get tearful, and then they may ask you about what's going on. You may not have like full recall of all of that. And so in the day to days afterwards, you'll have a session with your therapist to discuss what came up, and then how do you maybe understand things differently now, or how does that change your point of view, or and then what are you going to do with it? How do you incorporate that into your day to day? And the thing with our program, we recommend 4 to 6 sessions over 4 to 6 weeks. So it's a slow process, and that way you have time to like integrate after each session and continue to build from one to the next. So it's not a one and done. You're not just relying on the medicine to make change, because that doesn't usually work.
Well, a comment I've heard, and this could relate to doing psilocybin, ayahuasca, all of these medicines, is if you don't do the integration work, there's a real danger that the journey was just another really interesting experience.
Yeah.
Basically. Yeah. Yeah. And you've met them. I've met them. Someone said, "Oh, wow, I have this life-changing experience. Just got back from Peru," or this or that. And you talk to them 3 months later and nothing's changed, because the integration work wasn't done. And I think also really good preparation is helpful. So, I mean, we believe, because we prepare people and we try to set up people for success in a sense, in that they can step into the experience fully. Right? Because it's a different experience for a lot of people. Talk about Thank You Life that you're partnering with, because I know one of the things you're passionate about is making this more affordable and accessible to people. How does Thank You Life come into play? And anything else you want to mention about that?
Yeah, so Thank You Life is a nonprofit, and they do solicit donations in order to provide reduced cost services for specific ketamine, say, groups or workshops that providers are offering. And you can write for essentially like a grant from Thank You Life to support that sort of project in your practice. Another thing you can do with Thank You Life is, as a for-profit business, we can't solicit donations, but we can through the partnership with Thank You Life. So
they're 501c3.
Yes. Yeah. So they, if we collect donations through there, we can then funnel those into sliding scale or reduced cost services for our clients.
Wonderful. Well, I invite everyone to go to your website. There's a lot of information out there. They can find out about the other people that are part of your team. They can connect with Thank You Life. You have other services in addition to ketamine assisted psychotherapy. Please I'm going to put this website in the description that accompanies this video, but please give that out if you would, Tiffany.
Oh, yeah. Yeah. So Asheville Integrative Psychiatry.com is
Very straightforward.
Our website. And if you wanted to email us, it's info@Asheville Integrative Psychiatry.
Wow.
So,
fantastic. Well, Tiffany, I've attended events that you've hosted, and you always do a great job presenting. I love when you brought that film in about the young man who passed away. What was the name of that film?
Yeah, The Last Ecstatic Days.
Last Ecstatic Days.
Yeah.
Powerful, powerful movie. So I really, really value and appreciate the work that you're doing in this community to help people find services, find the medicine, get the support they need. It's so desperately needed. And is there another question you wish I had asked you or I should have asked you? Is there anything else before we bring it to a close?
There is one thing, and I'll say that, one of my goals in this work is to provide a high level of care and to establish a standard of care for psychedelic medicine in North Carolina. And in doing that, I think that pushes a lot of people out of being able to access the care due to, it's all done on site here, it's not affordable. And so we did create the Watershed Healing Collective to provide ketamine assisted therapy in a therapist's office without medical monitoring across the state of North Carolina. So any therapist in that network can access us for screening and provide that care to their clients who are appropriate. And that's something we're doing now, and we've seen a lot of adverse events with ketamine. We know the risks, and we know it's not safe for everybody. And so we're doing our best to continue to provide a standard of care while also increasing accessibility.
Wonderful, wonderful. And I'm sure, we all expected MDMA would finally get FDA approved this year. Didn't happen. A lot of disappointment. Annie and Michael Mithofer live right up the road from me, and they got to be shaking their heads. A lot of people are, but I'm presuming that once that gets approved, that'll be also a service that you'll be providing since you're trained in that. And it's also a very, very effective medicine for healing.
Yeah, definitely.
Yeah, right.
Fingers crossed.
Yes, well, hopefully soon. It's desperately needed. Thank you so much, Dr. Sauls. I appreciate you joining us. And thank you to those who are watching this video. If you have questions for Tiffany, drop them in the comments. I'll make sure that she gets them and I'll make sure that you get the response back if you don't have direct connection with her. If you like the video, give us a thumbs up. And if you like this kind of content, I really invite you to subscribe and hit that notification bell so you don't miss upcoming videos. We're doing a lot of videos right now around plant medicine, psychedelics, meditation, movement, breathing practices, these kind of transformative practices that are very, very effective and powerful when done appropriately. So thanks again, Tiffany. And
thank you, Eddie.
See you all watching next time.